March 10, 2023, a federal courtroom in Detroit, Michigan. After years of investigation, after a trial that destroyed his practice and drained his life savings, the jury deliberated for one day. Their verdict? Not guilty, on all counts. Dr. Leslie Pompy had been vindicated, but here's the question no one wants to answer. Railroaded, the story of Dr. Leslie Pompy. If he was innocent, why was he prosecuted at all? Monroe, Michigan, a small city near Lake Erie. This is where Dr. Leslie Pompy chose to practice medicine. After earning his medical degree, he could have gone anywhere. Detroit, larger cities, more prestigious practices. Instead, he opened Pompy Family Medicine in Monroe, a community practice, primary care for everyone. Monroe County, 90% white, but with pockets of underserved populations who had limited healthcare access. Dr. Pompy treated it all: hypertension, diabetes, infections, routine illnesses, and yes, he treated chronic pain. Patient: Dr. Pompy was the only doctor who would see me, the only one who would help with my pain. Not a pain clinic, not a pill mill, a family doctor doing what family doctors do, treating the whole patient. In a community that needed him, he showed up. He accepted Medicare, Medicaid. He treated people regardless of pay. And for that, he would face decades in federal prison. Here's a fact that prosecutors don't want to talk about. Black physicians face higher rates of prosecution than white physicians with comparable practices. It's not speculation. It's data. Studies show black doctors face disproportionate scrutiny, higher rates of investigation, and increased likelihood of prosecution. Dr. Pompy was a black physician in a 90% white community, treating pain patients, prescribing controlled substances. In 2020, the DEA and FBI began investigating him. In 2022, they indicted him, on multiple counts, alleging he prescribed opioids without purpose and failed to adequately monitor patients. The prosecution's theory? That Dr. Pompy prioritized money over medicine, that his practice was a pill mill in disguise. Never mind that he wasn't running a cash-only operation. Never mind that he accepted insurance. This was primary care. Never mind that his medical records documented treatment rationales, monitoring efforts, and legitimate medical necessity. The government had decided he was guilty. Now they just had to prove it. The trial began. The prosecution presented their case. They cherry-picked patient charts. They highlighted imperfect documentation. They pointed to patients who misused medications against Dr. Pompy's instructions. But the defense fought back. Board-certified pain specialists reviewed the records. One by one, they testified. Dr. Pompy's care fell within accepted standards. This was not criminal. This was medicine. Dozens of patients testified. Community members spoke. They described a physician who treated them with dignity, who was the only doctor willing to help them. No scheme, no pill mill. The defense proved what should have been obvious from the start. Dr. Pompy was practicing medicine. March 10, 2023. After one day of deliberation, the jury returned. Not guilty, not guilty, not guilty, on all counts. Dr. Pompy broke down emotionally. His family cried in the gallery, vindicated. But here's something the prosecutors didn't know. While he was fighting for his freedom, while his practice was collapsing, Dr. Leslie Pompy went to law school. Think about that. Under federal indictment, facing the loss of everything, and he used that time to study law. Because if the system was going to try to destroy him, he was going to understand that system completely, inside and out. That's not the story of a guilty man. That's the story of someone who refused to be broken. Not guilty, but punished anyway. Legally, Dr. Pompy was innocent, free, but here's what not guilty doesn't fix. Financial ruin, practice destroyed. Legal defense cost up to $1 million. Years of lost income. Debt that may never be repaid. Reputation damaged forever. His patients were abandoned. During the trial, they were cut off from care. Some suffered withdrawal, some gave up entirely. Dr. Pompy has his medical license. It's active, unrestricted, but he hasn't returned to practice in Monroe. Phones disconnected. A community that needed him lost a doctor who cared, and he lost everything he built. Not guilty, but punished anyway. Dr. Pompy's story isn't unique. It's a pattern. Black and brown physicians face questions their white colleagues don't. Investigations, scrutiny. When they're driven out, acquitted or not, it's their communities that suffer. The patients who are already marginalized lose the most. Dr. Pompy survived. He went to law school while fighting for his life. He won his freedom, but how many others didn't? The system that prosecuted Dr. Pompy faces no consequences, no accountability. They just moved on to the next case. So what are you going to do about it? Demand equal justice. Demand that racial disparities in prosecutions be addressed. Support minority physicians. Call out injustice when you see it. Visit unbedsidemanners.com for more information. Dr. Leslie Pompy dedicated his life to an underserved community. His thanks: years of hell, bankrupt, practice destroyed. They took years of his life, proved nothing. But the damage was forever. Railroaded. Not guilty does not equal justice. For every physician prosecuted without cause. For every community that loses a doctor who cares. For justice that means more than a verdict.